This segment is brought to you in part by Southwest Washington Medical Center.
Welcome back. 12 million Americans suffer from peripheral artery disease. Now there are more options when it comes to treatment. Kara Mack tells us about a device being deemed as the crown jewel of PAD treatments.
Not long ago, David could barely walk, but it took this little boy named Abijah to motivate him to finally be treated for peripheral artery disease.
I have a 4-year-old grandson, and I have to admit, in all honesty, that was a catalyst for change. He's very special to me. I wanted to be around to see him graduate from college.
David is not alone, but among 12 million other Americans suffering from the disease. For treatment, he turned to the experts at Southwest Washington Medical Center.
Peripheral arterial disease, or PAD, is atherosclerosis disease, or literally plaque that deposits on the inside of the arteries. And it occurs in all the arteries throughout the body. But when we talk about PAD, we're usually referring to anything below the heart and extending down into the legs.
Got to the point where I was beginning to question whether I was going to wind up in a wheelchair.
David, like many people when he came to see me, was smoking, and he had some problems with cholesterol, although he didn't at that time have high blood pressure or diabetes. But he had severe problem with walking. In fact, he was only able to get about 1/4 of a block to half a block before he got this cramping in his legs that I've described before. And when we did an angiogram to look at all his problems, he had multiple areas, both in the left side and the right side, where there were narrowings in the artery, which required intervention. And some of these were located in places where they weren't ideal for a stent placement. And so a couple of his lesions were actually ideal for the Diamondback device.
Southwest vascular surgeons are among the first in the Pacific Northwest to offer the Diamondback 360, an excellent option for patients facing major amputation because of advanced PAD.
The Diamondback is called a rotational orbital atherectomy device, and it is literally a crown encrusted with little diamond chips, which is mounted on a wire which rotates in an eccentric fashion so that as the revolutions occur, it starts to grind away at the inside surface of the artery, and in doing that, it grinds off pieces of the plaque. And the pieces of the plaque are so small that they pass right through the circulation.
Thank God for technology. I mean, it's an amazing technology.
One that helps when plaque buildup is so severe that stenting alone can't do the job. It's the crown jewel of PAD treatments.
Initial evaluation, we usually look to perform a procedure where we don't leave anything inside the patient because there are complications associated with that. So the first line is usually an angioplasty. But if that is inadequate, then we look at one of these devices to so-called debulk the plaque, in other words, to take some of it out, whether it's the laser or the Diamondback. And then ideally, if we can leave the inside of the artery without a stent or a graft in it, we tend to get longer-term results.
It's returned my life to me.
For more information, check out their website at southwestmedicalcenter.com.